Get some great tips for myofascial release self-treatment using a small, soft ball. Great ideas for use every day. Plus, it not only helps release your fascia, it feels awesome. At Essential Therapies, our focus is treating the fascia, and we also want to teach you how to treat your own fascia. And one of our favorite tools is this small, soft ball filled with air because it is very forgiving. It's not too hard. So here is a quick tutorial on how to use the small, soft ball to treat your own fascia. First of all, we want to remember that we never force the tissue, okay? So using a lacrosse ball or a baseball or anything that's hard, even a tennis ball can be pretty tough and actually forces the tissue. This ball, and you can fill them up at different densities, it can be, firm, and that's okay as long as you're still not forcing the tissue, or you can have it really soft because you're tender in that area. So let's start by showing you how to use it against the wall. Let's say one of the areas people have a lot of tension in or difficulty is in the back body, right? So above the glutes or even through the glutes, the piriformis is a spot that gets a lot of attention. So what we'll do is take the ball and place it between the wall and your body, wherever you feel you need it. And it's okay to kind of move it around a little bit to find that spot. It's just a little bit tender. And here's the spot for me. Now I'm not going to keep rolling on it, okay? So that's something different. That's like a massage. That's not myofascial release. We want to find a spot where it's like, oh, that feels good. And then you're going to hang out here and that's it. And you're just going to chill. So what you don't want to do is land on a spot that's really tender though, and it's kind of even hurts, because what happens, and even though you might feel like you can, force through it, again, that's forcing the tissue, you're actually creating an environment where the fascia is, oh no, we got to protect, and then it's not releasing, right? It's tightening up. So you want it to be comfortable. If it's a super tender area, just move off of that area a little bit and then hang out there. So you could, if you had two balls, put it on both sides. Just make sure that you're right across from each other, okay? If you're going like this, then we start talking about the pelvis getting rotated, and there's actual specific treatment to fix that. But right now we're just gonna release the tissue. So find a good spot there. You can even go up into the low back, anywhere along here, maybe even into the shoulder blade. A really great spot to work is this whole sort of upper trap area into the shoulder blade. So let me just see if I can find a good spot here. Whew, right there. Now, you can see I'm kind of further away from the wall with my feet, but it takes a little bit of practice to get proficient at it, but it won't be long and you'll know right where to put that thing and to hang out, okay? So this is a way that you can use the ball on the wall, but you can also take it to the floor. So I have a separate video on how to treat scar tissues in the abdomen. I've had 2 C-sections, so there's a whole separate video on that on our YouTube channel. You can check that out. But let's say, actually I'm gonna start with the stool. You can also do this sitting in a chair. Let's say you wanna soften the hamstring area, the back of the thigh. Just place it underneath. Find a spot that needs some relief, and that actually feels really good. I use this a lot in the car. I have long drives a lot, so I'm going to go to the outside part of the thigh here. Sometimes you can even kind of pull the tissue of the leg off to the side. The ball is kind of under there, and now it's giving a little bit of pressure, just enough to settle in. And the question is always, how long do we stay here? So remember, with myofascial release, we take up the slack, gently go into that barrier. We don't force the tissue, and we wait as long as we can, towards up to 5 minutes. Like 3 to 5 minutes is when we start to get the change in that collagen. 5 minutes usually though is when that collagen really starts to make a change. You can stay longer. So I tell people, stop when you need to, of course, but if you can, try to stay 3 to 5 minutes longer if it's feeling good and you feel like you could really use some more. When it gets to like 10 minutes though, be cautious, especially if you're putting a lot of pressure in an area, you're changing, the blood flow isn't getting in there necessarily during that time. So, that between 5 and 10 minute mark, is great as long as it's feeling good. Okay, so I will move this all the way down the leg and get the hamstring this way. A couple of other ways you can do it on the floor. Just real quick from the video where I'm working on the scarring in the abdomen, anywhere in your abdomen between the pubic bone and the rib cage is game, especially off to the sides. If you find an area that's tender, like right in there, looks like I could use a moment here. Just let yourself settle in. Now here's the thing. If it's painful, you never want to be there. Again, don't force. But sometimes when you first get there, it's like, something's going on, and you let yourself settle in for like 30 seconds. If that pressure or the discomfort starts to increase, you got to move the ball. If it's starting to settle down, sometimes that first 30 seconds, it's just like our brain is getting used to the fact that there's a ball in our belly, right? So it takes a moment. And after that 30 seconds or so, if it's like, oh yeah, I can relax and breathe into this, and it just feels like I have a ball here, then that's okay. So you can use the ball to soften that area as well. You can take the ball now on your back, same way we were doing against the wall, in those key areas in the buttocks and into the back and even up into the upper trap area. I love doing this one under both sides. And if you need to support your head, please do that. So you don't want your head tilted back really far. Actually, here feels really comfortable for me. I've got the balls in the upper trap. It's getting some gentle pressure there. I would hang out here for a while and really get some opening. Actually, this feels really good. I don't want to leave, but you get the idea. The other thing you can do is take the ball underneath the sacrum, so that triangular bone at the very base of the spine. So lifting up, put the ball here, find a spot that's comfortable, and just settle in. This feels really, really nice. You can watch your legs. If you want your legs to just really relax, you can let them fall in like so and rest this way. And just like we did sitting, you can take the ball underneath any part of the leg all the way down. Here's another trick. On your side, I like to do it this way to get the inner thigh. And I always say if you feel like you have to balance it and you're gonna kind of lose it, you can put a blanket over your leg. So I do this oftentimes in bed. So the blanket helps to hold things together and you can work it all the way up. Feels really good. A great spot for this is the calves. It's a little bit harder to balance without having a pillow or a blanket over, but actually this feels super great. So many people have tightness in the calves, and this is a really great way to just kind of relax into it. Now, if I'm doing it here, I'm not really relaxed to try to show you this position, but if I bolstered myself with some pillows, I can completely relax in this position with the ball doing a little bit of pressure there. So, all right, those are a few tips to get you started using the soft self-treatment ball from Essential Therapies. And check out our YouTube channel for more education. Have a great day. Please like this video if you thought it was helpful, and subscribe to our channel for updates on upcoming videos for myofascial release and self-treatment. And remember, you are creating tomorrow's body today. Thanks for watching, and follow Essential Therapies on Facebook, Instagram, and check out our website at esstherapy.com.